Okay, Greg 10. So, welcome back. We're going to continue on this week with the nervous system. And specifically, we're going to be talking this week about conditions affecting the nervous system. So, these would be disorders and diseases if your nervous system's not functioning properly. Now, we did something very similar to the other systems. We went through the gastrointestinal. We talked about some of the conditions related to gastrointestinal, like diseases such as Crohn's disease, irritable bowel syndrome, a gluten intolerance. And then we also talked about cardiovascular diseases, something like heart attacks, blocked arteries. We talked about strokes. We're going to be talking, again, which is kind of somewhat a neuro disease as well. Okay? So today we're going to go through the nervous system, okay, and some of the conditions that and problems that they can develop. Okay, so just to recap, the basic functioning of the nervous system. Okay, we have sensors, control center, and then responses. Okay, so what a sensor is they're throughout your body. Okay, all of our touch, our sight, our ears, those are all sensors, as well as we have sensors throughout our body, in our fingertips and underneath our skin. So what normally happens, if we just do a quick animation just to recap this, normally happens is, say you sense something. So say I sense something in my left hand. Okay, so that sense is going to go up through this, what's called the nerve, up into my spinal cord, and then up into my brain. And then my brain starts thinking about that. Okay. Now, after it's done thinking about it or creating a response, it's then going to send a signal out. Now, that signal then is going to leave the brain, go spinal cord, and then to various parts of the body. Now, I have it going to a different arm from that point of view, but I mean, it could be going to your leg, it could be going to your chest, it could be going to various parts of your body. Okay. Now, the big thing I just want you to keep in mind is that it's not the same neuron that sends the impulse, like the sensor neuron is different than the response neuron. Messages can only go one way. So if I send a message to the brain through a specific neuron, I can't send back the response back that same neuron. We have separate ones for them. Okay. Now, one thing I was just thinking about this the other day is what happens when your foot falls asleep, or everybody's had it maybe when your leg falls asleep. Well, what you've technically done there is you've pinched a nerve. Right? You haven't severed it, because if you severed it, it means that you wouldn't be able to ever move your leg before. But what you've done, and usually it's because of the way that you're laying on your leg or the way that you're positioning, is you're doing something like you're pinching a nerve. So if you look down here at the bottom right, if you laid on your leg and this nerve was pinched, okay, what the problem will be is now if you try and send a message, a sensory message, let me go back to my highlighter here, a sensory message up to your brain, you never get it, so you can't feel it. And that's why when your leg's asleep and you touch it with your hands, you can't feel anything because that message isn't getting all the way up there into your brain. It's getting stopped because you pinched it. As well, if you try and send a message down to your leg, it can be difficult because you can't get any kind of sensory feedback. So sometimes when your leg's asleep, you'll fall when you try and walk because you're not getting that sensation of, where is the ground and how much pressure do I need to put on there. So then your brain can't give you the proper signals, right? It's trying to give you the signals, but it has no sensory information. Okay. Now what will happen is over time it'll wear off, that pinch will loosen up, and then you'll be able to get your sensors back, and then your leg's not asleep anymore. So that's what happens when your leg's asleep. Okay, just recapping some of the learning check that I had last week. So a couple of the questions I asked you about where if, police or border patrols people were trying to evaluate whether you were on a stimulant or a depressant. And what they'll start looking at is things like your pupils. They'll start looking at your heart rate. They'll start looking at your breathing rate. And based on those kind of things, they're trying to determine what kind of drug that you potentially would be on. Okay. Now, also, you've probably heard of anxiety before. It's saying, oh, I'm an anxious person or I have an anxiety. What anxiety is really just an overactivation of the sympathetic nervous system. Okay? So people that have anxiety disorders means that they have difficulty relaxing, that they're always nervous and they're always really kind of have this system active. And it can cause problems because it wears you out and it makes you constantly be kind of active and thinking about things, and it's difficult to function that way. So that's why people who have really high levels of anxiety have an anxiety disorder. Okay, and it's really an anxiety disorder. It's just the inability to relax yourself, the inability to relax or to activate your parasympathetic nervous system. Okay, so going through nervous system disorders. So just to recall, the brain is a control center of the body. Okay, it controls everything in the body. It controls all of your systems. So the brain controls and regulates many of the organ systems in our body, the ones we talked about: cardiovascular, respiratory, GI. So if the brain is not functioning correctly, it can have a variety of different symptoms and affect a number of different parts of the body. So if you have damage in your brain, it can lead to digestive problems because your brain is controlling that digestive system. It can lead to heart problems. It can lead to muscle problems. It can lead to a number of different problems because, again, it's controlling all of your organ systems. And then the last thing I just kind of want to mention on the basics of the brain is that when the brain stops functioning, that's clinical death. Okay, if your heart stops, you're not dead. You're not dead at that point. Okay, you still have 6 or 7 minutes before usually your brain starts shutting down, and it's your brain that shuts down is clinical death. Okay, it's not your heart. Okay, so the first thing we're going to talk about is paralysis. What happens when you become paralyzed and from your nervous system? So paralysis is when part of your body becomes unresponsive to the brain trying to move them. So you can't receive any sensory information from that area of the body, and you also can't move any areas of your body. Okay? So we call those people paraplegics if they are paralyzed from the waist down. So that means that you can't feel anything in your legs, in your toes, in your feet. You also can't move your legs, your toes, and your feet. You have no sensory information. Okay? And then quadriplegic is from the neck down. So it's caused, how it's caused is basically the inability of messages to be able to get to the brain and then back from the brain. Right? What causes paralysis is basically a cut. Now, before when we talked about when your leg fell asleep, that's a pinch. But if you completely sever it, okay, and I'm going to use a different color pen. So if I completely sever this, say I get into a car accident and I sever a major nerve right there, okay? So this major nerve gets severed. Then what will happen at that point, let me just erase this, is that now I can't get any information. I can't get any messages. So if I get any kind of message from, say, my toes, it doesn't actually get up there. It gets stopped because the nerve is severed. So I can't get any sensory information. So that's why you can't feel anything in your legs that are paraplegic. Okay? Now, also, if I try and send any messages, if I try and send a message, oh, I want to move my legs, it also doesn't get through, okay? Because, again, it's severed, so it never gets past that point. So you may think in your brain, oh, I want to move my legs, and that message goes down your spinal cord, goes all the way down, and attempts to get to your legs to move them, but because the nerve is severed, it never makes it there. Okay? Now, if you are a quadriplegic, that means that you've severed the nerve quite high up. So something like, say, up at this point. Okay, which is much more severe. Now you can't get really kind of any information. You won't be able to feel your arms and legs. We'll talk about that coming up. Now, this is usually a permanent thing, which is quite sad and debilitating. But for younger patients, they sometimes have the ability to reform connections. So sometimes you'll hear of people that have been paralyzed and then they can walk again. It usually is dependent on age. The younger people are sometimes able to start taking nearby nerves and then reconnecting them. And it doesn't work for everybody, and it takes a lot of work to be able to do it. Okay, so we're talking about the different nerves and being severed in different spots. So people who are quadriplegic or paraplegic, what they've really done is they've severed a major nerve that runs down our spinal cord. So if you look at our brain, and then we take a look at our spinal cord, okay, we have a major nerve that I'm kind of highlighting here in yellow. I'm going to pick a different color so you can see it better. I'm going to highlight it here in green. Okay? So this nerve runs right down our back. It's really what we consider our spinal cord, because what our spinal cord is really just all of these major nerves running down and then all the vertebrae connecting them. Okay? These nerves are so important that we encase them in bone, and that's what our vertebrates are, and that's really what our backbone is. All our backbone is basically a covering for this major nerve called our spinal cord that runs down. Okay? That's what your spinal cord is. It's just a major nerve where all connections come down. So if I want to move my leg, it comes down this one. If I want to move my waist, it comes down. When I'm running, it comes down. If I want to breathe, it comes down here. Okay? Now, once the message comes down here, it leaves the spinal cord at certain areas. Okay? So, for instance, if you want to move your head around, okay, then you would get the message from your brain. It would come down here, and then it comes out to your neck, and then you move your neck. Okay? So people who, say, have a severed, or say get their backbone, say, severed here, okay, they'd still be able to move their neck because that message can still get down there. Okay, looking at some of the other messages here, okay, they would still be able to move their fingers because we can still get that message. Okay, we'd still be able to move the hand because we can still get to that message. Okay, now what we wouldn't be able to do though is if we tried to get to something like down here, okay, and trying to move our foot, we would not be able to move our foot because as that message tries to get down to the foot, it's been severed there and it won't be able to get there. So it'd be inability to move that foot. Now, if we look at another example here, a more serious example. Say you get severed, a major car accident, and your spinal cord gets severed right there. Okay? That means that all of these functions are lost right now because now the messages can't go anything lower than that point. You would still be able to do everything up here. Okay? So your neck muscles, you can still move your neck. You can still breathe. Okay? Luckily, our diaphragm control is very high up. Okay? So even quadriplegics can usually breathe because they're quadriplegics. Usually, this is a severing is lower on the neck, so they still be able to breathe. You can still move your shoulders, but you wouldn't be able to move your waist, your triceps, or your fingers. Okay, so that's why oftentimes when you get into a car accident or you come in, doctors or nurses are wanting to know, well, what vertebrae is the sever at? And they'll come in and say, what vertebrae is it? C5, C6, T1, T4, and they're basically referring to where on the spinal cord is the severing, so they know the severity of it and whether this person is going to be a paraplegic or quadriplegic. Okay, the only other one I was going to talk about today is multiple sclerosis. So multiple sclerosis is another brutal neural disorder. It's a disease of the brain that begins attacking some of the cells in the brain. Okay? So this disease results in the brain being unable to deliver messages, in particular to areas of the body. Okay, we'll talk about why it can't deliver those coming up. It's not the same reason as someone who becomes paralyzed. Okay. Paralyzed means that the nerve is completely severed and there's no way to get that message completely across. But in multiple sclerosis, the nerve isn't actually severed. Basically, the nerve just isn't really good at conducting the message. The message never really gets all the way through. So if someone who has MS tries to, say, move their legs, okay, so they get the message in their brain and they're like, I want to move my legs. So they send that message down their spinal cord. And it goes all the way down their spinal cord, and it's getting to their legs. So what happens is the message starts to get a little bit spotty. Okay, it can get there, but it's not a full message, and sometimes it doesn't even get there at all. So sometimes MS patients will have difficulty walking or moving, and especially initiating their movement, because although they want to do that, and it's very frustrating for the patients because they think it, and they say, I want to move my legs, and that message gets all the way down there, but as it's traveling, it never makes it to its intended spot. Okay? So basically the response messages from the brain are not as strong and consistent compared to a healthy individual. Now, this problem is also sometimes it's very strong and then it fades away, and then it comes back and then it fades away. That's why people with multiple sclerosis will sometimes have their symptoms reoccurring. They'll cycle where they'll come on really, really strong. They'll be, say, maybe even paralyzed for a couple hours or even a couple days, and then after those couple days they can recover again, and then it comes back. So it's a cyclic kind of disease. And here's kind of a good picture of what's happening here. Okay, so as I get this message in my brain that basically say I want to move my legs, okay, that message gets going down there, okay, and then it never makes it to my legs. It basically kind of falls off there. Okay. Now the reason for it is when we send that message, we send the message down this little tube down here called a nerve. Okay, so this is basically a nerve. Now, similar to how an electrical cord gets wrapped in rubber, okay, you can kind of think of this as an electrical cord or the copper wire, and we wrap electrical wires in kind of an insulator to make sure that the electrical signal gets all the way through. Well, it's no different in our nervous system. Okay, we have this wrapping around the nerve called myelin, and that basically makes sure that the signal, as it's traveling down, use a different color here. So as the signal is coming down here, if you don't have myelin, the signal will start to pop off here. and it'll come off here, and it'll come off here, and it'll come off here. Similar to how sparks would start flying out if you had an electrical cord that was frayed like this. Okay? Well, that means that you don't get 100% of the message here. You may only get 40% of it, or 20%, or sometimes 0% at all. Okay? Where someone like here, the message never comes off, it travels all the way down, and you get 100%. So this is an example of someone who's healthy in normal nerve conduction, where the message gets sent and never comes off until its intended target. Where here, the myelin sheet, or the insulation for the nerve, basically starts deteriorating, and then they never get their messages all the way through. Okay, now there is some other conditions that affect the brain, are very serious, and they affect the ability of, sorry, just one second here. So disorders and diseases that affect the brain are very serious, and they affect the entire body's operational ability. Brain diseases are not known as well as other diseases due to the complexity of the brain. So we are just starting to understand more about. So a lot of we've started to understand mental health illnesses a lot more, where we're just starting to realize that they are diseases, and again, it's affecting the functioning of your brain, which can have a huge effect on your entire body and your overall health. Alzheimer's, dementia, stroke, bipolar disorders, all of these things are all related to disorders of the neurosystem. Okay, something that we're learning more about.